So what are some of the most common symptoms of fentanyl withdrawal and what you will most likely be feeling when you go through this detox? And this is from the experience of somebody working in the psychiatric setting and seeing the most common detox symptoms, and in particular for the acute withdrawal. Now, number one, we'll jump right on into it. Flu-like symptoms time 100. Now, I know in the last video I did in this, people were like, oh, flu-like symptoms, you don't know what you're talking about. No, what I mean by that is flu-like symptoms times 100, okay? I'm not talking, oh, you have a little headache, a little bit of nausea, a little bit of vomiting. No, when I say this, I mean you're going to be having extreme diarrhea per se. You're going to be having extreme abdominal cramps. You're going to be going from hot to cold continuously over and over. You won't be able to lay down in your bed and get a good amount of sleep. You're going to be tossing and turning. You're going to be curled up in a ball a lot of the time. And this is for people who've once again been using chronically in particular. If you've only used fentanyl for, like, for example, on and off for a couple weeks or even a couple months on and off, it'll be a more mild like. But if you've been using it daily, for example, the Roxys, heroin, even for example, high doses of opioids, like even oxycodone, hydrocodone, yes, they fall into the same category. So times 100 for the flu-like symptoms. And once again, with this, when you're, a lot of times what I see when people are in bed, when they're initially detoxing, which, let me clarify, what I mean by the initial detox is typically after your last dose, typically it starts within 6 to 12 hours after, and then the acute withdrawal, which means the most intense part of the withdrawal, is going to take place for 1 to 3 days. So once you hit that 6 to 12 hour mark after your last dose, it's going to start kicking in and it's going to peak 1 to 3 days. And variance in particular how long it can last, on average, this is on average now, the acute withdrawal is anywhere from 12 hours after last dose to up to, what I've seen, even 5 days. And this is for the acute withdrawals of the flu-like symptoms times 100. So it's not like just having the flu. I'm clarifying that now. I'm just using that to have some sort of comparison or baseline that we can kind of look at it and draw to if you've never went through this before, okay? So let me clarify again. Severe, you're going to be vomiting, extreme diarrhea, abdominal cramps, going from hot to cold, not being able to sleep. And remember, a lot of times why you're having a lot of this diarrhea, it's because a lot of times when you're using opioids, opiates, you're not digesting well as it is, to where you're having severe constipation. So it's kind of like that reverse effect of it. Okay, so flu-like symptoms times 100. Let's just put it that way. So don't get on my butt about this time. Number two, we're going to hit on this again. Your sleep and insomnia are going to be horrible. Your sleep, which is, you're going to have a lot of insomnia. So sleep is going to be really, really hard. And even when you have medications to assist with it, unfortunately, it's just part of the process. In particular, that first 1 to 3 to 5 days in general, your sleep's going to be really bad. But I encourage anyone, if you can hold down anything for at least a couple hours, where you can't, like, if you can hold anything down, because at least you somewhat digest it in your mouth even, and somewhat in your stomach. If you can put down a nausea medication, to even hold down some fluids, for example, and just get get something going in your bloodstream to, even help just with your blood sugars as well. That will sometimes help a little bit with the sleep. So getting that nausea under control to potentially take something to help with the sleep. But your sleep is going to be really tough, which is going to make it harder for you, because when you're not sleeping, that can lead to things such as even worse confusion, not DTs, that's with alcohol, but sometimes hallucinations can come with acute hallucinations that will resolve. Nothing too serious to worry about with opioid withdrawal. but that can somewhat happen if you're not sleeping. So that's another thing. Your sleep's going to be really messed up. And this is for people, once again, these are the most common. So this is just to let you know that when you're going through these, it's typically not a medical emergency. I don't want to say it's never, but compared to something such as benzos, where you have the chance of having seizures and whatnot, if you've been using those long term and you cut them cold turkey, that's a different story. But with opioids, if you cut them, if you cold turkey it, a lot of times you're not going to have a medical emergency with it. Now, it can lead to things where you have things such as diabetes, even type 1, to where you're needing your insulin. That could potentially lead to a medical emergency. And if you're not sleeping well, you get confused, you're not getting your blood sugars checked, you're not checking them, you're not getting your insulin, that can potentially lead to one. So if you do have other medical conditions or whatnot, you might want to consider discussing with a doctor. Now, number 3, mood swings. Now, actually, let me back up. We're actually going to go for number 3, bone pain. I say this because a lot of times when you're using a lot of these opiates and opioids and fentanyl for a long time, there's something where it can get into your bones. In particular, with things such as Suboxone or Subutex or even methadone, can be even worse with it. That's why people sometimes think that methadone or Suboxone withdrawal is really hard, because it can come in spurts of acute withdrawal because of how when it gets in your system, it stays in your system a longer time. But even with fentanyl withdrawal, when you're going through this acute withdrawal, you do have a high chance of having really bad bone and joint and achy body, to where you're going to feel, which is going to lead to a lot of irritability and frustration and just wanting to relapse. So this is all part of the process, but I put this because this is another thing that is very, very common, is that just body aches, these deep body aches to where you just want to crawl out of your skin. You feel like you're that skin crawly feeling, that as well, which leads into the 4th one, which can lead to really bad mood swings, even when you're going through acute withdrawal, because your body's craving the fentanyl or the opioid or the drug, to where when your body isn't getting it, and if you're not being able to hold down any fluids, if you're taking any medications as well, your body is not getting that on top of it, to where you're just going to have really bad mood swings. A lot of times people get really frustrated, and if they're detoxing, if they've been using really hard, for example, heroin or fentanyl, a lot of times they won't be able to get out of bed. But I've heard, for example, patients just moaning and groaning and screaming because they're like, I need something, but they literally cannot get out of their bed because it's that painful. The pain on a scale of 0 to 10 can be anywhere from, in my opinion, always a 10, and they'll report it even higher. They can't even report it. That's how bad it can be sometimes, but it's part of the process. If you can get through the first 3 to 5 days, you'll get through the physical withdrawals, which then will lead to the post-acute withdrawals, which for some people is actually harder than the physical withdrawals. Whoa, whoa, whoa. You'll go, whoa, whoa, whoa. That's not true. No, it is. Some people, even from patients, they said they would rather go through the physical withdrawals again. Once again, if they're in a setting where they have the care they need, not having to obviously work or anything, nothing like that. They'd rather do that than go through the mental cravings of the post-acute withdrawal, because that sometimes can lead. And if you even, for example, like just for fun, I've looked this up on the computer, it'd be like, oh, it will last maybe a month afterwards. No, it can last a long time. A lot of times that can go anywhere from a minimum of 3 months to up to 6 months to a year, up to a couple of years. It's very, there's a variance with that I can't even give you an answer to, because everyone's body chemistry is different. But I can tell you, if you are younger and you're using fentanyl in particular, and obviously older people as well, you can get off, but it's going to be easier for younger people because their bodies aren't near as beat down. They're younger, their organs aren't near as old as older people. They might be beaten up from use and maybe polysubstance use with drinking, but it's easier for someone that's younger to recover from this long term. So I encourage anyone out there, if you are using fentanyl, there's good news. Assuming you don't have a medical condition with it, you can cold turkey it, because unfortunately with time, the overdosing off of it is getting a lot worse. A lot of stuff, it's is laced with fentanyl today, and it's stronger. It's a lot stronger, but you can get off it. That's the good thing. And compared to benzos, you eliminate a lot of times the seizure risk. However, if you have something such as a condition such as epilepsy or medical disorder or condition, that doesn't put you that doesn't clear you. I'm just saying, compared to some other drugs, getting off them, it's horrible and hard, but there's less of a chance of having a medical emergency while doing it. But if you can, I encourage you once again to try to take nausea meds, and if you can hold anything down, that's just going to assist with it. In the next video I'll talk about some remedies that do help, that's accessible to anyone that's over the counter, that can help if you're going through the process of fentanyl withdrawal. And everything I'm telling you, if you're cold turkeying it, I wouldn't advise anyone to taper off of fentanyl in particular. If it's pain medication, that's different. It'll be a little bit easier, but sometimes with pain meds in particular, it's good to just pull it and cold turkey it. You can taper as well, but you have that option to stop all at once at least. Like and subscribe. Next video will be out soon. We'll be talking about some of the remedies, and then I'll also be doing that video where I'll be doing the Bible study one that I'll release soon, which I'll talk about at the end of the next video I do, what it'll be about, or I'll put a community post on it. Love you all. Like, subscribe to the channel. Keep putting out more stuff. Leave a comment if you've ever been through fentanyl withdrawal or opioid withdrawal or whatever kind of withdrawal. Love you all. Have a happy Thanksgiving and happy holidays.